Welcome to the deep dive. Ever wondered what really goes into a full health assessment when you visit your provider? We're looking into the key steps today and, why they matter for understanding your overall health.
Exactly. And it's not just for doctors. Knowing this framework helps you understand, well, what info they're gathering and why.
Mhm.
It makes you a more informed participant.
For sure. So we're covering everything from the main reason you're there, the chief complaint,
Right.
to the nitty-gritty of your current issue, past health, family patterns, lifestyle, um, a quick run-through of body systems, and key bits of the physical exam.
Sounds good.
Let's start with that first question everyone gets asked.
Yeah.
What brings you in today? That's the chief complaint, or CC.
Right. It's the primary reason, straight from you. Like, I've had this sharp chest pain for 2 days. Simple as that. That's the starting point.
And then to really understand that complaint, providers use the history of present illness, the HPI.
Yeah.
It's like the detailed story.
Yeah, and there's a great mnemonic for it, old carts. It helps make sure nothing gets missed.
Old carts. Okay, break that down for us.
Sure. It stands for onset, like when did it actually start? Location, where exactly is the pain or the symptom? Duration, how long's it been going on?
Uh-huh.
Characteristics, what does it feel like? Sharp, dull, eking, aggravating or alleviating factors, what makes it worse or better?
Okay.
Radiation, does the feeling spread anywhere else? Timing, is it constant or does it come and go? And finally, severity, usually on that 1 to 10 scale.
Wow, yeah, that builds a much clearer picture than just chest pain. So after digging into the now, we look back with the past medical history, PMH.
Correct. This is your broader health story. It covers any chronic stuff, like hypertension or asthma.
Right.
Also, any past surgeries or hospital stays, your immunization records, super important allergies, of course, and a list of all medications.
Including over-the-counter things.
Absolutely. OTC meds, vitamins, herbal supplements, everything counts.
Good to know. Then there's family history, FH.
Hmm.
Looking at your relative's health.
Yes, and this is crucial for spotting potential genetic risks. We ask about conditions like high blood pressure, certain cancers, diabetes, stroke, any known genetic disorders in close family members.
Do doctors map this out?
Sometimes, yeah. A genogram can be used. It's like a family health tree. And it's interesting. Sometimes family history can be, well, more predictive for certain things than even your current lifestyle.
That is interesting. Okay, next up is social history, SH. Your lifestyle, basically.
Exactly. This covers tobacco use, alcohol, any recreational drug use. Also, your occupation, education level, living situation, who your support system is.
So quite personal stuff.
It is, but it all impacts health. We also touch on sexual history, exercise routines, and diet. It paints a picture of your environment and habits.
Right. And the last history part is the review of systems, ROS.
Yes, the ROS. Think of it as a quick head-to-toe symptom check based on what you report.
So it's subjective.
Totally subjective. For the respiratory system, for instance, the provider might ask, and you'd say, no cough, no shortness of breath, no wheezing. It's a sweep to catch anything missed.
Okay, that covers the history taking. Now, the physical exam, we can't cover everything, but let's hit some major systems, starting with neuro, the nervous system check.
Yep, neuroexam. The goal here is to assess brain function, cranial nerves, those are the ones in your head, and your motor and sensory status.
So what are they actually checking?
Key things include your level of consciousness, are you alert? And orientation, do you know who you are, where you are, the date? We call that oriented times 3. Also, checking pupils react to light, that's per RLA.
Per away.
Pupils equal, round, reactive to light and accommodation. It tells us about brainstem function. Then there's muscle strength, balance like the Romberg test, where you stand with eyes closed, reflexes, speech clarity, and how you walk, your gait.
Got it. Next system, respiratory, checking the lungs.
Right. Evaluating lung function, how well you're ventilating, the effort involved. The provider will look at your chest shape and how you breathe. Listen with a stethoscope to breath sounds.
Front and back.
Front, back, and sides, yep. Listening for clear air movement or anything abnormal like crackles or wheezes. They might also feel your chest expansion. Percussion, tapping is sometimes done too, but that's a bit more advanced.
Okay. Moving to the heart cardiac assessment.
Assessing heart sounds, the rhythm, blood flow perfusion, and general circulation. This involves checking your pulse, listening to heart sounds at specific points on the chest.
Is that the APE to man thing?
Yes, that's a way some remember the valve locations. Aortic, pulmonic, Erb's point, tricuspid, mitral. Also checking the apical pulse directly over the heart, peripheral pulses like in your feet, capillary refill in your fingernails, and looking for any swelling or edema.
Comprehensive. And lastly, the abdomen.
Checking the organs in your belly, bowel activity, any tenderness or unusual masses. Here, the order is really important. Inspect first, just look at the shape. Then auscultate, listen for bowel sounds in all four quadrants.
Why listen before touching?
Because palpating or pressing can stir up bowel activity and change the sounds you'd normally hear. So inspect, listen, then maybe percuss or tap, and finally palpate gently for tenderness, guarding, or organ enlargement. They might also listen for a bruit over arteries, an abnormal whoosh sound.
So you can really see how all these pieces, the history, the systems review, the physical checks, they all fit together. It's quite a process.
It really is. It builds a comprehensive, holistic view of a person's health at that moment. And understanding these components, well, it just empowers you as a patient.
Definitely. You can have better conversations with your provider, knowing why they're asking these things, why they're doing these checks.
Precisely. It demystifies the process a bit.
So here's a final thought to leave with our listeners, thinking about all these interconnected parts, the history, the exam findings. What single aspect, if you had to pick one, do you feel is most revealing about your own overall well-being right now? Something to ponder. Thanks for diving deep with us today.